What if I told you that some of the most powerful clinical decisions in healthcare happen in the space between a doctor's order and a nurse's hands? That's nursing pharmacology. And it's not just memorizing drug names or scanning a medication chart. It's understanding how a drug works, why it works, when it can help, when it can harm, and how small details can completely change the outcome for a patient. If you're a nursing student, a new nurse, or just curious about what makes pharmacology so important in nursing, this is one of the most useful skills you can learn. Because in real life, medication isn't just a task, it's a chain of decisions. A medication is only as effective as its mechanism allows. For example, if a drug lowers blood pressure, a nurse needs to know whether it's doing that by relaxing blood vessels, slowing the heart, or removing excess fluid. Why does that matter? Because the side effects, monitoring, and patient teaching will be different depending on the mechanism. Let's say a patient is taking a diuretic. A nurse isn't just watching for improvement, they're watching for dehydration, low potassium, dizziness, and changes in kidney function. That's the real job, connecting the drug to the body's response. This is where pharmacology gets interesting. Every medication has a route, a target, and a timeline. Some work fast, like intravenous medications used in emergencies. Some take hours or days. Some need food. Some should never be crushed. Some look simple on paper but behave very differently in older adults, children, or patients with liver or kidney problems. That's why pharmacology is really about patterns. A nurse starts to ask, what system does this affect? What should I monitor? What could go wrong? What patient factors change the effect? Here's the part that matters most in practice. First, the drug class, not just the drug name. If you know the class, you can predict effects and side effects much faster. For example, beta blockers often lower heart rate and blood pressure, so you check the pulse before giving them. Second, the major side effects and red flags. Not every side effect is an emergency, but some are. A nurse needs to know the difference between expected mild nausea and a dangerous allergic reaction or signs of toxicity. Third, safe administration. This means the rights of medication administration, checking orders carefully, and understanding high-alert medications like insulin, anticoagulants, and opioids. Fourth, patient education. This is where nursing becomes powerful. A patient who understands why they're taking a medication is far more likely to take it correctly. For example, explaining that antibiotics need to be finished, even if symptoms improve, can prevent treatment failure and resistance. Think about insulin. It's not just giving medication for diabetes. It's about knowing the type, the onset, the peak, and the risk of hypoglycemia. That changes how you coordinate meals, monitor blood sugar, and respond if a patient feels shaky or confused, or anticoagulants. These can prevent life-threatening clots, but they also raise bleeding risk. A nurse needs to know what to watch for: bruising, blood in urine, black stools, or sudden weakness. That knowledge can catch a problem early. The fascinating part of nursing pharmacology is that it turns medication from a list into a story. A story about how the body responds, how disease changes treatment, and how nurses protect patients through knowledge, timing, and judgment. So if pharmacology ever feels overwhelming, remember this: you don't need to memorize everything at once. You need to understand how to think about drugs, and that skill can make all the difference. The most fascinating parts of nursing pharmacology, what nurses really need to master, is just one small part of pharmacology. If you're interested, our full free pharmacology course is linked in the description.